I'll be your student nurse today. May I go ahead and get your name as well as your date of birth? All right, Roger Kilman, June 15, 1968. That's correct. So we have used our two identifiers using the wristband as well as using his name and his date of birth. So now I'm going to go ahead and verify for allergies. Do you have any allergies in specific to iodine and latex? So no allergies. So now we're going to go ahead and proceed with our procedure. All right, so I have a Foley catheter here. So now let's go ahead and verify the order, see if everything is correct. And indeed it is correct. Okay, so I do have my Foley, some 2 towels, tape, gloves, and my waterproof pad. So prior to starting the procedure, I'm gonna go ahead and don my gloves. I did do hand hygiene when I was introducing myself. So we're gonna provide that perineal care now, okay? So I'm gonna go ahead and move the blanket down, okay? All right, and I went ahead and closed the door to provide privacy for our patient. So now I'm gonna go ahead and lift up your gown, okay, Mr. Kilman? And we're only gonna expose the area that we're gonna be using, okay? All right, so now I'm gonna go ahead and take my waterproof pad and place it below. And sorry, just a little bit more. All right, so now I'm gonna go ahead and get a wet towel and provide that perineal care. So is it okay if I go ahead and grab you now? All right, I'm gonna go ahead and go from the knees downward. Throwing that down. Now I'm going in with a dry towel and pointing it down. How are you doing, Mr. Kilman? Alright, you're doing fine. So as I was doing that perineal care, I was assessing to see if there was no sign of infections, and he is free of infections. So now we're going to go ahead and proceed with our Foley catheter. I'm going to go ahead and do hand hygiene again. Oops, sorry, I'm going to put my tape here. So I'm going to do that again. Okay, so I'm going to grab my catheter now, place it on the rest. And I will be throwing this away. So let me do it again because I did reach under my waist. So now I'm gonna go away from me, still keeping that sterile field. So I'm gonna move it a little bit down, providing that. Can you turn off the abanico? So we're trying to provide sterility here. So trying not to cross my fields. All right, so now I'm gonna go ahead and don some gloves. So grabbing them and placing them here. So something here that would go ahead and break my sterile field is the fact that the table is below waist level. So that would only break my sterile field. So if I was in a hospital scenario, I would have already placed a table above. That way I can work more sterilely up here. But in this case, I only have this table, so I just wanted to mention that prior to starting. So now I'm gonna go ahead and open them and place them there. So now I'm gonna go ahead and grab the tabs and open away. I'm gonna go ahead and grab my glove and pinch, go in. Sorry. And now I'm gonna go ahead and go from the cuff and in. Okay, so I can't go ahead and fix my cuffs. That would break my sterile field. So I'm gonna go ahead and go with the waterproof pad now and open it. And still trying to be in the sterile field. So I'm gonna go ahead and grab my pad, trying to make sure that I do not touch the patient. So going below and going there. And I'm gonna go ahead and move this out of the way. You're still trying to be in my sterile field. And gonna go ahead and place the drape over him, maintaining sterile field still. So what we have here is some iodine swab sticks as well as some lubricant. So I'm gonna go ahead and place the lubricant here, and we need to go from clean to dirty. So gonna go to dirty and still trying to maintain that sterile field. And I would go ahead and open this, place my swab sticks here, and to dirty. All right, how are you doing, Mr. Kilman? Pretty good. All right, so now I'm gonna go ahead and take my catheter out, trying to unwind it and still maintaining in sterile field. Trying to unkink it and everything. So trying to keep it in the sterile field. If that were to go out of the sterile field, I would have to start all over again. Okay, so now I'm gonna go ahead and swab. So using the swab sticks, I'm gonna do it 3 times. So I'm gonna go ahead and grab you now, okay? So swab, and then go, and then swab, and then go to dirty. And I accidentally touched the meatus, so that would break my sterility of this hand, so I would have to start all over again. So now I am gonna go ahead and grab my catheter. Still trying to keep that sterile field here. So dip it in the lubricant. And now I'm gonna go ahead and insert the catheter, okay, Mr. Kilman? So take a very deep breath. So trying to insert this here. And still not trying to touch the genitalia. And if I was to touch the genitalia, I would have to start all over again with this hand. So we're gonna go to the Y. So now I'm gonna go ahead and move my left hand to the catheter. Now using my other hand, I'm gonna go ahead and remove the cap of this. I'm sorry. So grab and now place the 10 mils. And there we go. So I placed all the 10 mils, which inflated the catheter, so it won't move out. So now I'm gonna go ahead and clean the area, and the catheter does naturally come out, so because our body wants to expel it, so it's okay. It'll stay in its place because the balloon is in there. So now I'm gonna go ahead and clean my area, as well as taking this out of here. And I'm gonna place this here to clean up, okay? So take up all my drapes. And in the hospital setting, I would be throwing this away, but since this is a reusable kit, I'm going to go ahead and place it on that side. And now I'm going to be ripping this. Taking it out of the way. And taking off my gloves. Placing this over here. So we're all set. And now I'm going to go ahead and grab some tape and tape the catheter to Mr. Kilman's cath. How are you doing, Mr. Kilman? Pretty good. All right. Trying to find this. And we need to give them some slack just for movement and so forth. So I'm going to go ahead and place that in their cath. And I'm going to go ahead and hang this on the side for Mr. Kilman, okay? I'm going to put that there. So, all right, we're done, Mr. Kilman. I'm going to go ahead and lower the gown down and move up your blanket. Okay. So is there anything else I can do for you while I'm here? No? Okay. So now I'm going to lower the bed. Your possessions are here, as well as your call light is next to you. So you can give me a call whenever you need, okay? So thank you so much. Go. Hello. My name is Marilyn. I'll be your student nurse today. I'm here to remove that catheter that was inserted. Go ahead and get your name. Okay. Roger Keelman, June 15, 1968. Correct. So we did use our 2 identifiers, and I did note that he is not allergic to anything. So now I'm going to go ahead and remove that catheter, okay? So I did look at the order, and this was a time needed to take out that catheter, okay? So now I'm going to go ahead and place some clean gloves. How are you doing? Excited to take that out? I bet. So we'll go ahead and do that. I'll try to make this fast, okay? So now I'm going to go ahead and drain all the urine out of the catheter. So I'm going to place it on an open. And now I'm going to go ahead and collect all the urine. And what I would go ahead and do with this urine, I would go ahead and document and note anything, any odor as well as color, any abnormalities. So I'll go ahead and document that. So now I'm going to go ahead and throw away these gloves to my trash can, perform hand hygiene again, and go ahead and place new gloves on. Okay. Trying to make this speedy for you, Mr. Keelman. So now grabbing my 10 mils syringe. Go ahead and place that there. So I'm going to go ahead and lower that blanket for you, Mr. Keelman, to get it out of the way. And I did close the door for privacy purposes. So I'm going to go ahead and move up your gown, okay? Go ahead and do that. And we're only exposing the site that we need. So now I'm going to go ahead and remove that catheter, okay? So what I'm going to do is go ahead and get my syringe. 1 second. Prior to doing that, I'm so sorry, I'm going to go ahead and grab my waterproof pad, just in case any urine leaks out. And okay. So go ahead and deflate the balloon, taking out all the 10 milliliters of water that was collected to inflate that balloon. Gotta do it with force a bit. Now releasing that, I'm gonna go ahead and place my normal saline on this side. Now take a deep breath, okay? I'm gonna go ahead and remove the catheter, Mr. Keelman, and I'm gonna go ahead and grab you, okay? Is that okay? Okay. So now, deep breath, ready? All right, Mr. Keelman, that was it. I did remove your catheter. I'm gonna go ahead and throw this away. Put it in the biohazard, okay? So now I'm gonna go ahead and put down the gown. And did you feel any pain with that? No? Okay. So you're doing good, okay? Is there anything I can do for you? No? Okay. So I'm gonna go ahead and lower your bed. Okay. And your cobbles next to you, as well as your possessions. So no plugs, no everything, no nothing, sorry. We're all good now then. Don't hesitate to give me a call, okay? Thank you.